Hello, I'm Marianne. I'm a licensed veterinary nurse here at Boca Park Animal Hospital. While blood work is required for all anesthetic procedures, we also do recommend annual and regular blood work for our canine pets. We have written down a list of questions that you may have as a dog owner that we can help answer for you. Paula, what's your first question?
What is my veterinarian looking for on a lab test?
You know, it kind of depends. If your pet comes in with a presenting condition, not feeling well, not acting themselves, the blood work can tell us a lot of information. If it's something systemic, whether it's, an upset belly or, just not acting quite right, we can sometimes get some early signs of what may be causing your pet to not feel very well.
What information will my veterinarian need to know about my dog before the lab tests are performed?
The more information you give us, the better it always is. If your pet is acting normal and fine, that's great. It gives us a baseline. It tells us normal functions and normal values for all your pet's organs, as well as blood numbers, CBC, etc. If your pet's not acting well, please tell us everything that's going on, anything they may have got into, whether they're experiencing some vomiting or diarrhea, or just really lethargic. If they're drinking a lot of water, not a lot of water. If they're getting picky with their food when they're normally not. Any information that you can give us, whether you feel it's relevant or not, will help the doctor decide what could be going on with your pet and what further diagnostics may or may not be needed.
What questions should I ask my veterinarian about my dog's lab tests?
You just want to ask what the results are. If you have any questions, what they mean, what it could mean, what issues could be causing your pet's illness. Any questions is greatly appreciated by our doctors. They'll be happy to explain anything you may have.
Will my dog need an exam before the lab test is performed?
We generally like to see your pet within the year. If it's beyond a year, we do like to physically see your pet so we can see what's going on, look at their vitals as well as just their overall behavior. Visually seeing your pet helps us as well in the exam for any other conditions that may be going on that you may not notice or understand.
How is my dog's blood, urine, fecal, and or skin sample collected?
Blood is generally collected through the vein. We do what's called a jugular blood draw, where we do get blood from the neck or the arm. It just depends on, the comfort level of your pet. Fecal, we usually will send you home with a container. Once your pet does produce fecal matter, you will bring that sample to us. And skin, if there's any skin conditions, we do take a slide, and it's called what's called an impression smear. We take a slide and we push it on the lesions that your pet may have. Urine is collected either by free catch, or we do what's called a cystocentesis, where we actually stick a needle into the bladder. And I know this sounds kind of crazy, but it actually gives us the best sample. It's a very sterile sample and allows us to see whether your pet has bacteria or anything other that shouldn't be in your urine is there. And it's very safe, and they usually tolerate it very well.
How can lab tests help my dog?
It gives us a baseline. Even if they're feeling themselves, it gives us a baseline. Normal values, normal functions. So in the future, if anything does happen with your pet or they don't feel well, we can compare them to previous blood work to see if there are any changes. If they are not feeling well, it will help us narrow down why they're not feeling well. Is their liver not functioning properly? Are their kidneys not functioning properly? It allows us to direct our diagnostic care and medical care into a direction to help your pet.
How effective are lab tests in dogs?
They're very effective. They give us a lot of information. It allows us to see what's going on internally that we can't see or know what's happening. They're very sensitive material. The labs are very sensitive, and it does give us a lot of information.
How much do lab tests cost?
That's a wide range answer. It just depends on the type of diagnostic we are doing. But that being said, the earlier you come in and the more preventative care you do, the cheaper it can be, because we're ahead of it, we're on top of it, as opposed to bringing in your pet when they're very sick, where there's more diagnostics and there's more issues that arise. So the earlier you come in and we have those baselines, it helps us find what's going on a lot quicker, a lot cheaper, and a lot safer.
Are lab tests covered by pet insurance?
You'd have to check with your individual insurance. Some do cover lab tests and some don't, but just call your insurance company and ask them what they do and do not cover. And if you would like to schedule some blood work or an exam or have any questions, please feel free to give us a call, 702-675-7000.